I'm Dr. Sarmiento, Professor and Chairman Emeritus at the University of Miami in Miami, Florida. I'm about to demonstrate the application of a below-the-knee functional cast, better known as the PTB cast. I said better known because that's what the public usually refers to. However, it is not a PTB cast because the patellar tendon does not contribute to the distribution of weight-bearing stresses. It is a functional below-the-knee cast that allows the patient to flex the knee and extend it fully while still immobilizing the ankle joint. Even though we are using a model, we're going to pretend that this young gentleman sustained a fracture of the tibia, let's say at middle third, with an associated fibular fracture. The alignment so far is very, very good. It needs a little bit of correction, and the shortening that took place at the time of the injury was very acceptable. It is important for whoever applies the cast, whether it's a surgeon or an orthotech, to have before him x-rays showing the fracture itself in order to be able to make the appropriate corrections and the appropriate directions. It is important also that the patient be sitting up with the hips, knees, and ankles at 90 degrees. Incidentally, the cast, this PTB type of cast, should never be applied initially following the major insult that produced the fracture. This functional cast should be applied after the acute symptoms and signs have subsided. The patient is sitting up with his hips and knees at 90 degrees. I'm going to bring the legs together in order to make it possible for me to try to reproduce the alignment of the normal leg into the fractured leg. You don't want an individual who is very bow-legged on both sides to end up with a fractured leg straight and the other one bow-legged. So the cast has to be applied in 3 stages. It is essential that we keep in mind the 3 stages. It's a cast that requires very little padding in order to be able to obtain the best possible molding of the various bony and soft tissue structures. I'm going to roll the stockinette gingerly because I assume that the patient still has some discomfort because maybe a week or 2 or 3 weeks have already elapsed since the initial injury. The application of the cast should not be painful. And if any attempts to wrap plaster or plastic material over the extremity that produces pain, then the project should be abandoned for another week or so. I wonder if you can hold this bit up here with your wet hand. Okay. The 3 stages. The first one incorporates only the ankle, and the assistant should hold the foot at 90 degrees. The cast should never be applied with a knee extended, because in the process of doing so, you could readily produce a recurvatum deformity. As the ankle is dorsiflexed, but never forced into extreme flexion because of the chances of, once again, creating a recurvatum deformity. Gingerly, the ankle is held at 90 degrees. Then I'm going to wrap cotton over the foot and ankle. As I said earlier, there's no need to apply too much padding, though sufficient padding should be wrapped in order to be able to make the removal of the cast easier at a later date. 1 roll of cotton is sufficient. If I can have a pair of gloves. I'm not going to use plaster of Paris. I'm going to use fiberglass. which allows the application of a lighter appliance, which is very advantageous. Okay, if I could have some of the fiberglass, please. During the application of this first roll, or the stabilization of the ankle, there's no need to pay any attention to the fracture itself, which is located, as I said earlier, in this hypothetical case, at the junction of the middle and distal third of the tibia. I'd wrap plaster firmly but gingerly, and the two terms are not contradictory. The patient must have his knee relaxed, and the ankle, once again, is being held by the assistant with at 90 degrees without forcing it into extreme dorsiflexion, which is very, very harmful, or could be very harmful. I'm going to use 2 rolls of fiberglass for this first section of the functional cast. Later on, I will apply some more in order to give the material further greater strength. I'm going to mold. I'm molding gingerly over the malleoli, with avoiding pressure on the bony prominences as much as possible. I like to mold the longitudinal as well as the transverse arches of the foot in order to prevent any contractures that might be difficult to overcome at a later date. Notice that here are the malleoli, and I'm only about an inch and a half above it. I'm going to wrap the second roll in pretty much the same fashion, in the same manner, should I say. I'm trying to eliminate any wrinkles that I may have created, just for aesthetic purposes. Once again, here are the malleoli. I'm molding right behind the malleoli, next to the Achilles tendon, right over underneath the os calcis, over the longitudinal arch, as well as the transverse arch. Now I don't want the material to dry before I get started with the second roll, the second stage, should I say. which overlaps the first stage. I'm wrapping the same thing. One layer of cotton is probably enough for me. Some people prefer more. I don't really think it makes any difference. However, the molding of the bony and soft tissue structures is better if the padding is brought to a minimum. Notice that I have come up to here's the patella, here's the tibial tubercle, here's the tibial tubercle. Okay? And I'm going, with this roll, I'm going to overlap the first layer and come up to the tibial tubercle, no further beyond that point. The knee is still held at 90 degrees, the ankle is now fixed at 90 degrees. Okay, I'm going to overlap. Now that I'm over the fleshy part of the leg, now I begin to apply firmer pressure over the soft tissues. I'm not putting pressure on the bony structures, but over the soft tissues, particularly on the medial and posterior aspects of the leg. Right there, very firmly there. Very firmly there. At this point, now don't let the knee extend. The knee is still flexed at 90 degrees. Now, before the material begins to set, I can go ahead and begin to make whatever corrections I anticipate being able to make in the alignment of the fracture. Say if the X-rays show that there's some valgus deformity at the fracture site, then I can mold in such. Then I can create a varus moment, or the other, or the opposite, if the initial deformity is that of a varus. Now, this has been very firmly applied over the fleshy part of the leg with impunity. Here's the tibial tubercle. I don't want to go beyond that point. I'm going to put another roll. Another fiberglass. A second roll. Pretty much in the same way. I may not be able to compress as much because the material is already setting very firmly. But I still soft enough for me to apply further pressure with impunity. I assume that all other features are conducive to this firm molding. This should not be a painful experience. Repeat. Once again, I'm molding very firmly over the condyle, medial condyle of the tibia. The lateral, I'm not putting pressure on the lateral because that's where the head of the fibula is and where the peroneal nerve resides. So, mold it firmly. And while I am molding firmly of the medial aspect of the leg, I'm doing likewise posteriorly over the fleshy gastrosoleus group. I'm putting a special emphasis on compression of the tissues over the subpopliteal space and the medial aspect of the leg over the condyles of the tibia. The material is, for all practical purposes, set at this time. I'm going to go to the next stage. Charlie, I need a towel. Hold this up here. because a radical change has to take place now, and that is in the position of the extremity. I have to extend the knee and let it rest on my lap, relax, to about 45 degrees of flexion. No more, no less, approximately that much. And the patient has to be instructed to relax the quadriceps, because I'm going to mold on the patella tendon in a few minutes from now. And the knee has to be in 45 degrees of flexion in order for the patient to be able to fully flex and extend the knee upon completion of the procedure. I'm going to wrap the cotton pretty much the same way I did it for the first two stages. This is what I call the third stage. Yeah, it's pretty, the material is already set very nicely. So I'm going to overlap. Notice that the knee is flexed.